Hello everyone, I'm Satsagala. I'm happy to give you a presentation of this paper related to the COVID-19. So the title of the paper is on the policy analysis of Indonesia COVID-19 pandemic response. As you may already know, the COVID-19 pandemic is hitting many countries all over the world. That includes also developing countries with huge population like Indonesia. Therefore, it's important for us to know more about the situation that is being faced by Indonesia and also the handling of or disaster management to the safe case. This will be my presentation outline. So I'm going to talk about the introduction, the public policy and factors that influence the policy making, the Indonesia response, the dilemma and priority health and well trade-off, and the conclusion. So as of the 20 September 2020, when the paper is being written, the transmission rate of the novel coronavirus in Indonesia has not been slowing down, with COVID-19 confirmed cases reaching about over 240 cases, an increase of cases of about 3,989 people. So many news have reported that Indonesia's economic downturn is likely to be worse than previously expected. Responding to this, the Minister of Finance have allocated substantial amount of funds towards the healthcare sector as well as strengthening social safety nets and salvaging business sectors in order to sustain Indonesia economic growth. In this slide, we can tell about more introduction. For example, in June, some metropolitan areas in Indonesia, such as Jakarta, have started to transition to the new normal. Apart from the fact that Indonesia still does not meet the WHO new normal transition standard, this policy relaxation has triggered an increase in COVID-19 cases in Indonesia. Entering June, until now, the graph of the increase in cases in Indonesia has been significant. And a part of the increase of COVID-19 rate, the government still seems to prioritize economy. This is evident from the hesitation of the central government to firmly reinforce the total lockdown or PSBB. Thus, the whole situation makes our team want to know more deeply about the Indonesia's strategy, ambivalent strategy for handling COVID-19. Alongside the definition, the extent and substance of public policies may differ from government to government, which also depends on the system of government and its ideologies implemented. Scholars within political science fields have developed several approaches to analyzing public policy. For this paper, we'll take a closer look into Eastern system theory and also explanation of how economy directly affecting policy making. According to Easton, the political system receives inputs from its environment and converts them into outputs. These inputs can be in a form of demand from groups or individual or on a specific policy outcomes. The outcomes may interact with its environment and may generate new demands or supports from the groups and thus create a feedback loop or a never-ending cycle. McKee and Stuckler bring more direct understanding of COVID-19 and economy. It is said that previous crises, not exclusively health crises, have demonstrated that an economic crash has grave consequences for public health. For instance, the Great Depression in the past, or also like Indonesia, we had experienced the 1998 economic crisis, but a modern society has never been exposed to global scale pandemics such as COVID-19, and thus it takes us to the great unknown, an uncertain territory. So to mitigate the economic meltdown, the preservation of public health has to be prioritized. So a new study of 19 back to 1918, the influenza pandemic finds that in the 43 US cities studied, those that imposed restriction on social interactions earlier and retained them longer experience a stronger subsequent recovery, and therefore the authors reject the idea of trade-off between strict public health measures and economic damage. On the other hand, Lean and Meissner stated that both economy and public health are somewhat out of the control of local policy makers in a pandemic. A globally coordinated response may be most appropriate in this case. This may have just implied that national government is the front lead of both health and economic recovery and control. In the early phase of COVID-19, when other countries had been aggressively reporting positive cases, Indonesia had not been in the concrete action. Only on March 2nd, 2020, Indonesia confirmed the COVID-19 case. So those 2 months of waiting and obscure direction have just cost Indonesia months of preparation that might help the country combating COVID-19. After mass testing were conducted, it's still constrained by the lack of technical skill, and in fact, Indonesia has the fourth worst position in testing rates among countries with population of 50 million or more. In addition, the steps taken by the government can also be said to be confusing and cause a slow response. This response is also due to the complex bureaucracy. The urgency to prioritize economy is also one of the things that hinder the delivery of more effective response. For example, in the early months, the government took advantage of the momentum COVID-19 to increase the tourism sector by providing aircraft subsidies and endorsement for buzzers. Drastic deterioration of economic activity putting Indonesia at serious risk of COVID-19 induced recession. Entering the 6 month of the outbreaks where COVID-19 cases continue to climb, Indonesia is still hesitant to reenact lockdown policy. This can be due to fear of full-blown nationwide recession. We also recognize that the outbreak that imposed strict social restriction is likely to develop very differently in a setting in which there is a workforce with access free health care and income protection than in one in which much employment is casual and people must choose whether to go to work when ill or to starve. Indonesia is the latter. Social restriction policies stir up public unrest. It showed from demonstrations, such as in a couple of places like Jakarta and Ambon, against corona layoff and the PSBB or the Indonesia lockdown policy from mostly informal workers and small business owners. The healthcare budget and economic stimulus package may not be enough to weather the impact of COVID-19 and massive layoff only exacerbate the community vulnerability. So according to the system theory, the mass protest from the community can be seen as inputs that should be converting into specific policy, which is the outputs. Thus, in accordance to system theory, the ambivalent policy that seemingly prioritizes economy over health is a form of response of the government to public demand to return to work and reopen economy so that they can regain their welfare back. Lockdown policies might have been the most effective way to curb virus transmission, but it comes with severe economic implications. And as Indonesia economy steadily worsened, the government corner in the dilemma of health versus wealth trade-off. And financial crisis like what happened in the past, like 1998, has to be taken into serious consideration. As the most affected sectors are small medium enterprise, it is important that Indonesia should focus on devising economic recovery program that support the sectors rather than giving government bailout to big companies and also investors. Lastly, the resurgence of COVID-19 cases and its exponential increase show us that it is rather clear that Indonesia still not full the WHO criteria to implement new normal. Policymakers around the world experience the same dilemma, but it needs to be emphasized that any form of policy that is wanted to be implemented will not function properly if there's no coherence between national and regional policies. Until the third quarter of the disease spread, any strict and legally binding regional lockdown have not yet been in place. Initially, the central government forbid any local leaders from executing their own health quarantine measures, including territorial quarantine, without prior authorization from the national government. However, despite the statement that forbid regional government to implement their own social resistance lockdown, the Jakarta administration has issued Jakarta Government Decree, which stipulates the revoking the governor's transitional lockdown policy in reverting to the lockdown policy. Here comes the conclusion. So to conclude this presentation, it's very clear that Indonesia government caught in the dilemma of a trade-off between strict public health measures and economic damage. Relaxation of social restriction policies and also The reluctance to firmly implement containment measures policy are manifestation of the dilemma experienced by Indonesia. There are several reasons why Indonesia has positioned its economic interests. First, due to fears of nationwide crisis similar to the past, and according to decision theory, this demand is generally converted into outcomes, specific policy. In the case of Indonesia, outcomes is the decision of reopening the economy. Apart from that, limited financial and institutional capacity are also the things that narrow Indonesia options. In contrast to developed countries, Indonesia is unable to consistently provide social assistance, particularly during a pandemic, to hundreds of millions of its citizens. But risking the lives of many isn't worth the economic recovery. Economic and health are linked, thus to find a middle ground that can accommodate both needs are important for Indonesia. Lastly, it's clear that institutional deficiency, especially when it comes to multi-level coordination and policy coherence, are still a lingering problem. This particular issue highlights the needs of streamlined integrated national effort, such as the handling of COVID-19. Thank you for this opportunity, and this will be the end of my presentation. I would like to thank all the participants here, as well as the ICoSHIP committee who gave opportunity to present this paper, and also to Dipti who provided funding